Well, almost 40,000 cases of COVID-19 in India, 154 deaths in the last 24 hours. This is the highest number of cases that India has seen since November. The Health Ministry has confirmed that there are 400 cases of the UK, the South African and Brazil variants now being found in India. But the government so far has not attributed any link to the rapid rise in COVID-19 cases with the mutant strains that have been found in India. Let's first break down what the coronavirus numbers in the country are currently looking like. 39,726 cases that have been found in India. In terms of the worst affected states, Maharashtra continues to report the highest numbers in the last 24 hours. Maharashtra has reported 25,831. This is, according to the ministry, over 61% of the total cases. Punjab, Kerala, Karnataka and Gujarat are also reporting a surge, and I'll show you why. First, let's look at the deaths. Maharashtra once again reporting 58 deaths. Deaths in Punjab also very high at the moment, reporting 32 deaths, followed by Kerala, Tamil Nadu and Karnataka. Well, let's first take a look at Maharashtra. Now, this is an extremely worrying picture. If you look at the COVID-19 curve, so sometime here around September was the peak of COVID-19 in the state of Maharashtra, after which cases in the state continue to decline, and once again, as you can see this curve, cases are seeing an uptick, and this figure of 25,833 that's been reported on the 19th of March is the highest ever cases that Maharashtra has reported. It surpassed this September peak as well. So that's as far as Maharashtra is concerned. But like I said, it's not just Maharashtra that is a cause of concern. Take a look at this data that has been released by the government. This is data from 8 states, and let me just show you for an idea what the curve in each of these states is looking like. So if you look at Maharashtra, as you know, the COVID cases are surging. You can see an uptick in terms of the curve, but cases are also surging in Tamil Nadu. There's an uptick. In Madhya Pradesh, cases are surging. In Punjab, cases are surging. So if you see the COVID curve in these states, there is an uptick in the number of cases. The situation is no different in Delhi, Gujarat, Haryana and Karnataka. These are also states that are seeing a huge surge. Look at this curve in Delhi. Once again, it is rising. In Gujarat, once again, it is rising. Gujarat has seen over 1,200 cases in the last 24 hours. Karnataka is also bracing for a second wave. It's seen almost 1,500 cases in the last 24 hours. Similar situation being reported in Haryana. Let me also tell you what the vaccination tally in the country currently looks like. So this is the vaccine graph in the country right now, and if you look at the figures for the last 24 hours, as you can see, 22 lakh people have been vaccinated on the 18th of March as opposed to 20 lakh the previous day. So this is the vaccine curve as far as India is concerned at the moment. But a huge spike in COVID-19 cases is the big cause of concern. Let's try and make sense of India's COVID spike. We're joined by a panel of expert doctors. We have with us Dr. Jayaprakash. He is the former principal, Christian Medical College, Vellore. He's also a very well-known epidemiologist. We've been joined by Dr. Shashank Joshi. He is a member of the COVID task force in Maharashtra. Thank you very much for sparing the time and being with us on the show today. Dr. Joshi, coming to you first. I mean, Maharashtra is seeing the highest ever cases that it has reported so far. The government, by its own acknowledgement, has now said that there are 400 cases of COVID variants. You've talked about variants on several shows before, but no link yet being established between the two.
So thank you for having me. And I think whether there is a link or no link, clearly from day one I have been saying that this is a more fast transmissible strain. 1 month back, when very much on NDTV I said that there is a link between the Amravati variant and COVID, nobody took it seriously. In fact, Government of India actually denied it and said that there is no such link existing. The BJ Medical College microbiology team that time had identified clearly a 384 strain, which is similar to the UK strain, which is fastly transmissible. And in 1 month, you can see what has happened. We have hit the largest numbers. So clearly there is a different strain, whether it is homegrown or British strain or UK strain or African strain, we don't know. But it's a faster strain which has good recovery, low death rate, but it is rapidly spreading like wildfire. And you can see that Maharashtra is already in the second wave. And I think, it's unfortunate that India may soon follow the suit in various other states. And we need to have zero tolerance for COVID inappropriate behavior, but everything cannot be blamed on behavior because lack of COVID appropriate behavior is seen across the country. So why only Maharashtra or Kerala got singled out? And probably that was because in these less exposed areas of Vidarbha, particularly in Amravati, we probably did see an unusual strain which was faster spreading. Whether it is linked to outside import or whether it's homegrown, we don't know. That the genomic data has to be more transparent, and we definitely want to know what is that data and whether there's a linkage. But clearly the data indicates that we have spread it very fast and rapid, and we have seen a very large surge. And the bigger problem is that 80% of the cases are asymptomatic. So we have a lot of silent and super silent spreaders, and that has led and compounded the rapidity of spread. And overall, the public health strategy, particularly in rural Maharashtra, has been abysmal. And we need to increase our testing, our tracing, our isolation policies in a much more faster vigil. And remember, we are not locked at all, and we are unlikely to lock. We at best will do micro containment. So in these situations, when life is normal, we will need to be extra cautious and have a zero tolerance for any violators of protocols.
Right.
Unfortunately, that's not happening, and we need a very tight vigilance and also some sense of responsibility from citizens at large, not to behave recklessly.
Well,
so I think overall the situation is grim, it's pensive, and unless and until we don't take some very aggressive proactive steps, we will again head for another doomsday another 2 weeks from now. I personally feel that now the testing has been ramped up. In fact, in Mumbai city, we are going to now also test in malls, in markets, in places like stations, railway stations, bus stations.
Well,
random sampling will be done.
Dr. Joshi,
and
ramping up,
we will be able to contain the spread in the next 2 to 4 weeks.
Yes, ramping up testing is of course key, and you've always maintained this, that the variant strains is something that we need to look at more closely. More genome sequencing, perhaps needs to be done. Dr. Jayaprakash, how are you looking at this, the sheer numbers of what we're seeing right now? Dr. Joshi has said this time and time again that one needs to examine the spread of the COVID-19 variants more closely. The government yesterday out of the blue has come out and said that there are 400 cases of the UK, Brazilian and South African variants. We know for a fact that the UK variant is deadly. Look at what it's done in the UK. It spreads more quickly. The Brazilian variant is causing a high number of deaths in Brazil at the moment. We're reporting the second deadliest day in Brazil. And we know that the South African variant, the AstraZeneca vaccine doesn't work against it. So how worried should we be about these 400 cases that the government is reporting?
Thank you. I think I more or less agree with the predecessor who said, and I think we should be cautious when such situation happens. At the same time, I will not panic. Why is that? There are two important signs that I look for. Are people previously infected getting infected in large numbers? That is the first question you have to answer. And I get the feeling government has been watching that line. Second thing is, in other words, if it's only new people who previously uninfected getting mostly, then we need not panic. Second thing is, you have to keep watching the mortality. If there will be variation, and every virus varies all the time, does it make an impact on the mortality? Fortunately, India has had about less than 1/10 of the mortality as compared to other parts of the world.
Yes.
I mean, especially the developed part.
Yes.
So these two things have not changed, and I will still agree with my predecessor saying that we have to watch it, we have to study it carefully, but still going on a very large number of clinical
Well,
cases.
for a country as large as India currently, let me just put this in perspective. We have 10 labs that are doing genome sequencing. The government set a target of carrying out genome sequencing on 5% of positive cases. By its own admission, we're at 0.5% right now. So clearly, if more deadly mutant strains of COVID-19 are in India, the effort to identify them needs to be ramped up as well. We have with us a very important voice, Dr. Murthy, a consultant at the intensive care medicine at the University Hospital, Coventry and Warwickshire, joining us at the moment. Thanks so much. I want to ask you, Dr. Murthy, from your experience of what you've seen in the UK with what havoc the variant strains have wreaked, as far as the UK is concerned? What lessons do you think India needs to learn at this stage? Yesterday, the government has said that there are 400 cases of different variants that are being found in India. What can we do today so that, we're not facing a situation as deadly as what the UK has seen?
Good morning, and good morning to all my colleagues. Certainly the UK variant, which was first detected in October last year, and there was it is well publicized that there was a little bit of lackadaisical approach to it. And then we've had, due to Christmas behavior around about December, despite a very brief lockdown in November, we've had the worst of the second peak in January, February, and at the sharp end of it, in intensive care units, I've seen carnage. Initially, it was looking as if the UK variant was certainly more transmissible, but it may not be causing more pathogenesis, in other words, more deadly. But that's been revised, that it is more transmissible by a magnitude of 30 to 50% from the original strain, and it was probably mortality-wise, it's probably up to 20% more higher mortality it was causing. We've seen that play out in intensive care units,
right,
including our own.
So what needs to be done?
South African, yeah, exactly. So I think by the time the South African variant was showing up, I think we have learned lessons, and the Public Health England have really clamped right down on that. So increased surge testing, focused surge testing, postcode chasing. So they've actually got the South African variant when it first appeared in late November, right up to February. That was contained within a maximum of 295 cases. In other words, when through January we were seeing the UK variant at 60,000 at the peak, and then on an average 20,000.
Yes.
The South African variant was contained at a maximum of 400 cases by the end of February. So that's very well done.
But we also know, Dr. Murthy, I'm going to just interrupt you very briefly and bring in Dr. Joshi here. Dr. Joshi, the worrying thing is that, the UK, of course, many say has passed the peak when it comes to dealing with variants, but they also imposed one of the strictest lockdowns. Is that the only solution, Dr. Joshi? And that's the biggest fear that people have.
So, that is a valid fear. And if people do not behave appropriately and they continue their reckless behavior persistently, and if our healthcare infrastructure gets overburdened, the lockdown is only useful for healthcare infrastructure to have capacity building. If that gets overburdened, and currently it is still not overburdened, but we wish and pray it doesn't get overburdened, then obviously lockdown would be the only way out. I think the current strategy is a very aggressive public health emergency strategy, and containing and reducing. And we basically need a circuit breaker, or we need to declutter. I don't think lockdown would be a solution. Economically, it is not viable. But at the same time, if our healthcare infrastructure gets overburdened with the sheer number of too many cases, then obviously there will be a challenge. Currently, as I said, the recovery is fast. Most people can recover at home. The ICU admissions are less, and the mortality rate is very much down. So those are all reassuring signals, and our vaccination program with the most vulnerable needs to be finished as early as possible. If all those things are done fast and quick, probably we may be able to avoid a strict lockdown which UK had, which was in peak of its winter, while we are again a tropical country, and when the season changes, typically like last year and when summer sets in, we should be able to abate it if we are proactive this time.
That's a very interesting point, Dr. Joshi, and let me quickly get Dr. Murthy to respond to that as well. Dr. Murthy, do you believe that the vaccination helped the UK to deal with the variant strains of the virus? Because, was that really literally the shot in the arm that you needed to deal with how rapidly the strains were spreading?
There is no doubt about that. I think initially, around about February, we were thinking, what is the proportion of the impact of the strict lockdown they've had between December, as we are undergoing the current lockdown, versus the impact of the vaccination? And more reports are coming through that, if you clearly look at it, the over 65s admissions to hospitals have dramatically reduced. So the impact of the vaccination is there for all to see. And I would urge everyone, when their appointment has come through, please, there's no vaccine skepticism.
Right.
please vaccinate yourselves.
Well,
and of course, as my colleague said, continuing precautions, face mask.
Yes, I think what you're saying is extremely important advice, and the UK has just been through all of this. India at the moment at the cusp of a second wave, and variant strains are spreading rapidly even here in India. So all of what you've said from your experience is extremely valuable information. But I want to give the last word to Dr. Jayaprakash. Dr. Jayaprakash, just talking about once again just the numbers, 80.63% of cases are from 5 states, 65% of cases are from Maharashtra alone, and 77% of the total active cases are from Maharashtra, Kerala and Punjab. The Prime Minister has also spoken of micro-containment strategies. What needs to be done before this becomes a pan-India phenomena? Because it does at the moment appear to be concentrated in pockets.
Please listen. Remember what Dr. Joshi and a friend from UK said. This particular problem can be sorted out with adequate vaccination, number one.
Right.
Because that is why I said this is responding to the previous infection and the vaccine that we had created from the previous virus, which is a great thing. So there is no need for panic. Watch out for overloading of the hospital. If that doesn't happen, and see, we can manage most of them at home, and there is no panic. Remember, there are a large number of lives were lost during the lockdown last year because they couldn't reach hospital.
Yes.
We don't want a repeat of that. We need to look after corona. We need to look after other people also. And I think with the already available vaccine in our hand, we should do any foolish thing.
Okay.
Improve the availability of vaccine.
Well, absolutely, and I think that's really important advice at a time when India is reporting an average of 6.5% of its vaccines being wasted. So if you are eligible to go out and get the vaccine, you must definitely do so. Even the European Medical Agency has now come out and said that any risk associated with the vaccine is outweighed by the benefits that it has in terms of protecting you, or at least guaranteeing you some level of protection from COVID-19. Thank you, doctors, very much for joining us on the broadcast, sparing your valuable time. It is indeed a worrying surge in COVID-19 cases in India, a story we'll continue to track very closely.